morning all. I am Dr. Ankit Gupta and I am working as a consultant in Department of Neonatology and NICU at Medanta Medicity Gurugram Hospital. Today I will be talking about neonatal jaundice and giving a few tips about the same. Generally, newborns jaundice is a harmless condition. In majority of them, it doesn't cause any harm and it passes away after 2 to 3 weeks of time. But it is important to monitor it and treat it because if the jaundice goes above a certain level, it can affect our brains and have some consequences. But as I said, to reassure, majority of the cases are harmless and it goes away on its own. As I mentioned, generally jaundice in term babies, that is babies born at full gestation of 38 weeks plus, it generally weans off, it peaks at around 3 to 5 days and it weans off after 2 weeks of life. In preterms, the course is slightly more protracted. The jaundice peaks on day 5 to day 7 and it may take up to 3 weeks of life for the jaundice to wean off. However, it is very common to see that sometimes jaundice takes even 1 month or 2 months to completely go. As I said, we just need to monitor and act when the jaundice level reaches above a certain threshold. So in majority of the cases, we just need to monitor and not treat the condition. As I said, if the jaundice is below a certain level, it is a harmless condition. But yes, if there are certain limits, when it crosses those limits, we have to treat. So we generally have a couple of options. The first one, which is routinely used, is called the phototherapy, in which we keep the babies under LED blue lights. We keep the baby under blue lights, but now we have got very good source of blue lights, which are the LED lights, and the jaundice generally weans off within the next 24 to 48 hours of lights. Majority of the babies got treated by phototherapy alone. In some cases, if the jaundice level is very high and it is affecting the brain or it doesn't come down on phototherapy, then we have an option of double exchange blood transfusion, in which we replace the baby's blood with a fresh blood and bring down the jaundice level. However, it might seem scary, but to be honest, in the last few years of advancement and advent of the LED lights, the exchange transfusion is very rarely used. Initially, when we are using it almost every weekly or every monthly, nowadays we have to use it once or twice in 2 years, 3 years. So it is very rare. And most of the babies jaundice get resolved just on phototherapy. As I said, jaundice is mostly a harmless condition. It is a physiological byproduct of our red blood cells breakdown in the body. But yes, there are certain things which we can do to prevent it from becoming a severe jaundice. That is the jaundice at which we require treatment. For that, the first important thing we can do is regular breastfeeding or regular feeding for the baby, as it helps us to excrete the jaundice from our body. Another important thing is we should be aware of the mother's blood group and the baby's blood group, because there are certain conditions in which there can be blood group mismatch and that can predispose babies to jaundice, developing severe jaundice. So if we know the blood groups beforehand, then we can do monitoring accordingly and pick up the jaundice in early stages. Also, sometimes doctor advise you to get some blood tests, including of thyroid and some metabolic enzymes for the baby, which can predispose to jaundice. So I would advise parents to definitely go for those. If it turns out to be positive, then again we can monitor jaundice accordingly. We should do any procedures or any feeding we are doing at home in a clean manner so that baby doesn't get infection, which is also an important cause of jaundice in the early newborn period. Again, I would say that the most important thing is doctors generally ask the parents to come in a couple of days to monitor the jaundice. So I would urge parents not to miss that, just to come for the regular follow-up so that we can pick up it in early stages. So if we pick it up early, then jaundice doesn't cause any havoc and we can treat it very easily. So it's a slightly controversial topic. So yes, the studies have found that sunlight definitely helps in clearing the jaundice, and the babies develop less of yellowish discoloration if they are exposed to sunlight. But the important thing it is a filtered sunlight which we have studied. So if we put the baby under direct sunlight, there are a couple of harms that baby can get skin burns. The baby skin is very gentle and very fragile, so that the baby can get under direct sunlight, can get skin cancers. So it is very important that while sunlight helps in decreasing the jaundice, it is only the filtered sunlight which helps and which is safe for the same. So parents have to take care not to put the baby under direct sunlight. What filters to use, it is still a matter of research. Some studies there have been some studies using different filters, but as a general advice, we don't advise the parents to put babies under direct sunlight, but yes, under filtered sunlight, it helps in clearing the jaundice. But we have to be cautious about the dangers as well. So there is, mother should eat normally, and there is no specific restriction on mother having anything in diet. She can eat anything, and it should generally include all variety of nutrients, including minerals, vitamins, carbohydrates, so as for a good maternal health in the postnatal period, as well as for a good for the baby's health. But specifically for jaundice, there is no restriction. Mother should eat a balanced, healthy diet as is expected for a postnatal mother. For the expecting mothers, I would advise them to have their blood group done, because as I said, certain blood group incompatibility can predispose to jaundice. So if the mother knows about her blood group, then it helps us in predicting early onset jaundice. Otherwise, not to take much tension, she should take a balanced diet and carry on with the pregnancy. Jaundice in most of the condition is a harmless thing, and we can pick it up early.